So I know every time we do anatomical connections, I like taking the muscle connections and chains, and then you like doing joints. I'm sorry, but we're going to do it again, if that's all right. Because classically, we see that this gets taught basically, I think, I'm quite convinced that every chiropractic school, every physical therapy program, and every massage therapy program talks about upper cross syndrome because
Mm-hmm.
it is common as dirt. So here's upper cross syndrome. I want you to imagine that there's an X passing through my shoulder here, okay? Or like here. And so we've got a crisscross pattern. So we get muscles that are tight, over recruited, and therefore susceptible to injury because they're overactive. And then we get muscles that are on the other side that have just been shut down because of how much the other muscles are overtaking the load. So the crisscross pattern here is the pec muscle. The pec muscle is one that is frequently just spending all day adaptively shortened. It's tight, it's overfired. And sometimes you think like tight is good because then it's like active, but like you said, then if you go to accidentally quick stretch it too much the other way, because it's kind of been sitting in this high tonic and near tetanus phase, it's really easy to accidentally tweak it and overstretch it because it's just all balled up like that, right?
Right.
So you got the pec in the front here, and then the crisscross pattern is to go up into the neck and start looking at like the upper trapezius, the levator scapula, and the cervical extensors. Then the crisscross of the muscles that are therefore going to be weak, right, are the anterior neck muscles. So think like the deep neck flexors, the ones that actually are supposed to help elevate the ribs and get you to breathe, are the ones that actually help to facilitate you pulling your head back or getting it back like that. And then like the rhomboids and the muscles that are between like the shoulder blades. And that ties in just absolutely perfect to, you said, over pushing, over pulling. Way too much of our world is out in front of us pushing, and we
Mm-hmm.
just generally don't have enough activities where we're actually pulling.
Yeah.
So as a result of that, that bias of activity of daily living and performance, tight, tight, weak, weak, right? I know
Yep.
if you're listening to audio only, you're not going to see us touch, see the context that I'm making right there. But so what that ends up then being is we get these really predictable presentations with anatomical connections where because the pec is kind of tight like that, then we are frequently, even if we get somebody that comes in and complains of like a shoulder and we think like, okay, you really need help with like your pec muscles, we can very reliably predict that like at the very least you need some back of the neck work as well too, because that
Mm-hmm.
is just part of that tie-in connection. You can't, I say all the time that even if I just do a little bit of shoulder stuff and we do exercises at the shoulder or do some manual therapy at the shoulder, um, just by proxy of only working on that alone, you pull the upper back and the neck along for the ride. All three of those areas are such a tightly knit functional unit that you
Mm-hmm.
can't really do exercise or muscle performance on one and not throw undue influence on the other two areas. And
Right.
that's fine. That's nothing that anyone has to apologize about. Like, we're built to function holistically. We're not
Mm-hmm.
built to function in silos.
Right.
But it's just the reality of that, like, yeah, you pretty much like we have a pretty strong inkling that if we're getting a pec problem, we know that anatomically connection wise, we better be looking at the neck as well too, because we kind of just have to tie that all in to get the holistic treatment to get people to where they ultimately need to be.
Yeah, definitely. And then
Yes.
definitely going along with that, right?
Hmm.
I think about, your shoulder movement and how it can be so impacted by this as well, right? So not
Correct.
only just like passively with like the structure shortening and adaptively, but you think about how to bring your arm just overhead,
Yeah.
right? We have an attachment in our pec minor, which is our smaller muscle, the pectoralis muscles, right onto the coracoid process of your scapula, which is like that big bone back here that everybody calls your shoulder blade.
Yep.
Okay. So what happens is that when that pec minor gets tight, it can actually pull the scapula forward.
Mm.
And then that actually impacts the ability of our arm to reach all the way overhead, right? So we have something called the scapulohumeral rhythm. It sounds really fancy and really complicated, but all it means is like your scapula has to move in order for your shoulder and your arm to get overhead, right? So your arm has for every 2 degrees of arm motion, you have 1 degree of that scapula motion, right?
Hmm.
That's kind of like our normal rhythm. But if that pec minor is kind of clamping that scap down in place, you're going to get this motion where you're going to shrug up to try and get that motion because your scap isn't able to get that freely gliding. So that's another big thing that we look for is if you're like, hey, I can't reach overhead without like doing this and it's super uncomfortable and I'm getting a pinching. That's another thing that we can really like start to see with that. Usually with the more extreme cases of like over adaptation and the chronic, more than I would say your acute injuries for pecs, but can happen a lot with that. It's just like your shoulder motion all of a sudden is horrible and it's because of your pec.
Yeah.
So